Hello, good morning. Today's topic drugs for cough. What is cough? A protective reflex that removes foreign materials and secretion from the bronchi and bronchioles. It can be triggered by inflammation in the respiratory tract or by undiagnosed asthma or coronary reflex with aspiration or by neoplasia. The cough are two type, productive cough and non-productive cough. The etiology of cough are upper and lower tract infection, postnasal drips due to sinusitis or rhinitis, smoking, chronic bronchitis, pulmonary tuberculosis, gastrointestinal reflux, asthmatic cough, drugs like ACE inhibitors and iodides, improper swallowing of food and water. The classification of drugs are three types, peripherally acting, peripherally and centrally acting, then centrally acting. Peripherally acting include pharyngeal demulcent, expectorant or mucokinetics. Pharyngeal demulcent soothe the throat directly or also by promoting salivation. Provide symptomatic relief in dry cough arising from throat. Example, lozenges, licorice, glycerin, linctus containing syrups, etc. Mucokinetics are secretion enhancers and mucolytics. Secretion enhancers include potassium and sodium citrate, iodides, ammonium chloride, guaifenesin, Vasaka. Mucolytics are bromhexin, ambroxol, acetylcysteine, and carbocysteine. Antitussives. What is antitussive? Antitussives that suppresses coughing, also known as cough suppressants. It include opioids, non-opioid, antihistamine, and pulmonary receptor desensitizers. Opioids are codeine, folcodeine, ethyl morphine. Non-opioid are nescapine, nextromethorphan, chlorpheniramine. Okay, antihistamines are chlorpheniramine, diphenhydramine, and promethazine. Pulmonary receptor desensitizer is prinoxidazole. Adjuvant antitussives. Adjuvant antitussives usually they are using bronchodilators. What is bronchodilator? Bronchodilators that open up breathing passages by relaxing bronchial smooth muscles. They make breathing easier who are all having asthma or some other conditions. Bronchodilators examples are salmeterol, salbutamol, terbutaline. It includes short-acting beta-2 agonists like albuterol, long-acting beta-2 agonists like salmeterol, formoterol, anticholinergics like ipratropium, and theophylline. Thank you for watching my video. See you next video. Okay.